Hello, everyone. Welcome to Atp Live, and I hope you can see me. You can hear me. For those on Facebook, let me know you can see me, you can hear me, and welcome. I'm Dr. Gbemisola Boyede, and I'll be answering your child health questions in the next 1 hour, hopefully, and then we can run it up by 7 p.m. So please, if you have any questions about your child health, feel free to post it whether on Facebook or Instagram or YouTube, wherever you're watching me from. And I will appreciate for those on Facebook if you can share the video. And if any of our moderators is watching, can you help me to share and pin the video on the group, because I don't have access to do that right now. So thank you so much uh, for joining me. All right. I was trying to see if I can get my Facebook. Oh no. All right. So if you have any questions, feel free to post your questions. And I'll be able to answer them. I will appreciate if my moderators can share the videos on our YouTube, and you can share it on our Facebook groups, because I don't have access to it and my phone is kind of in use right now. Thank you so much. All right, so welcome everyone. This program is brought to you by Ask Pediatricians Foundation. I'm going solo today. What we do in Ask Pediatric Foundation is to promote the health of children. Our goal is to ensure that no child dies from preventable causes. And so the way we do that is by health education, because majority of what kills children in sub-Saharan Africa and in Nigeria, there are things that we know, there are things that we can prevent, and there are things that are easily treatable. So ideally, our children should not be dying, but currently almost 1 million children below the age of 5 dies every year in Nigeria. So we're looking forward to reduce this horrible figures, and that's one of the things we do is by giving you health education and also by promoting information. I hope, let me just make sure my volume is right. Okay, so that's what we do. So this is one of our programs, but you can also join our Facebook groups from Monday to Saturday. You can ask your question on our Facebook group. We have doctors, nurses, pharmacists, health professionals that can answer your questions, including moderators. And we also do group discussion on various health topics, which you can learn from. We have 3 major groups. We have one for the children, that's the Ask the Pediatricians Facebook group. Then we have the Ask the Family Physicians, that's for the adults. And we also have a support group for those who have experienced miscarriages or loss of children, more emotional support groups as well. So you can join any of our groups. And also you can also check on our website, www.askthepediatricians.com. Where you can read about some of these topics in details, and of course you can drop your comments there as well. So I was saying all that's why waiting for you to all share the videos and for you to start asking the questions. So I think today I'm going to start from Instagram. Yes, I got lots of questions already on Instagram, people. Thank you. Okay, Shami King. Okay, Mena is the first person that's asking a question. He said, "Good morning, good evening, ma. What could be the cause of a child having two different shapes of hair?" Yes, two different shapes. I'm trying to understand that. So you're saying one hair is different from the other? Yeah. Okay, so usually when a child is born with a part of the body not looking typical, uh, we say maybe there's some form of, maybe the way it was formed in the womb malformation has happened, and it depends on what type of ears the child have, and depends on which one looks okay, which one doesn't look okay. So we really need to see it, and then we can advise depending. So for example, it can vary from just the shape. Maybe some people have their hairs, very prominent, very large, and or maybe the way they are shaped like cauliflower, or very, flat and all that. Sometimes that is just shape and doesn't really bother us, but sometimes we can have it abnormal in the sense that maybe almost one hair is missing, like those what we call microtia. In other words, the other hair is so small or is almost completely missing. So that may have implication in terms of hearing for the child. So it depends on what type of malformation it is, whether it's just something that is just a difference that we don't need to worry about, or whether it's something that is not just a difference, but it is something that has implication on health, like is it going to affect the child's hearing and all that. So the best thing to do is to take this child to see either a pediatrician or an ear, nose, and throat doctor, so that they can advise you appropriately on what to do. I hope that is helpful. The next question is by Toyi, and she's asking, my baby always bring out milk from his nose and mouth after meal, and what's the best way to treat colic in a baby? So generally speaking, for everybody who is going to ask me question, it would be nice for you to tell me the age of your baby. Don't just say my baby. I don't have that superpower to know which baby you're talking, how old is the child you're talking about. And for us as pediatricians, because we take care of children between the age of 0 to 18 years. So just saying my baby doesn't really help us. So we really didn't know how old is this baby, because some things in a particular child age may be normal, why it may be something that will worry me in an older child. So it's very useful, generally speaking, for everybody when you're asking questions to a pediatrician, to always let us know which age is your child so that we know what to talk. So, but going by what you're saying, because you're also asking about colic, so I'm assuming your baby is it's an infant, maybe a newborn baby, and all that. So babies can have reflux, but usually reflux is when they bring back a little bit of the milk that they have sucked. They can bring back a little bit of it, and that's because I always say I think I answer this question almost every time I come online, because there's a short distance between the mouth and the baby's stomach, and the food they are taking is mainly milk, which is liquid, and the what we call the sphincter, the gatekeeper between the food pathway and the stomach, is actually not yet well developed. So it is very easy. Ideally, food should not go back, from the stomach the other way around, but it's very easy to go back in liquid in a very small baby because of the short distance, especially when you also put the baby down flat, which is what most people do. You feed the baby has finished eating, then you just go and put down on the bed. So the milk can easily return. So what we normally do is keep your baby vertical for at least 15 to 30 minutes after feeding, and if you can just rub the back gently so that you can bring out the gas. And after that, most of the milk would have become curdled. The digestion process is ongoing, so the chances of it happening is reduced. It doesn't disappear completely. For as long as babies are on milk, the food can always go back, but by the time they start taking solids, then it's easier for it to stay down. So it can be mild in small children who are gaining weight. We just bring back a little bit of milk. We don't worry about it. But some children have very severe reflux that they bring out almost everything, and they are always, or they are even losing weight. For such babies, you have to see a pediatrician, because there are things we can do. We can sometimes have to thicken the milk. We have what we call milk thickeners, or we have to give some other medications to keep it better. Usually, those children usually have what we call the esophageal reflux disease, rather than just the mild reflux that most people have. So that's what you really need to do. Just after feeding your baby, don't always put them flat straight away. Try and keep the baby um upright. You can put them on your shoulder. If you are busy, you can put them in a car seat and sit it vertical. and before you eventually put them flat, and that will help. That is different from a baby who is vomiting. So a baby who is vomiting actively is a forceful process, and that is almost all the milk is coming out. Usually vomiting is something to worry about, and you really need to take a baby, irrespective of the age, who is vomiting, to the hospital. It's different from reflux, which is just a gentle return of a little bit of the milk. So they are two different things. I hope that's helpful. So then you asked about colic. So colic is one of those things that we say it will come to pass. In other words, it's one of those minor stuff in babies. Most babies have reflux, colic, and colic is when they cry for no apparent reasons, usually sometimes at night, and you've given them food, you're not wet, you've checked the usual stuff, and baby just keep crying. But baby is otherwise well, there's something wrong with the baby. So we call it colic. We are not really 100% certain why babies have colic. Sometimes we think it's associated with them trying to pass gas, sometimes, there are different theories behind it. So the most important thing is to keep baby comfortable. So you try, some babies like for you to carry them, sing, some maybe like for you to move them, some maybe like to have some noise going on, some maybe like to be, go in the movements, like some people put them in a car, move them around, and then they will stop. So sometimes there are really not much health medication, but sometimes we give some maybe Infacol, which is something you can buy over the counter, and it's helpful. And so, but sometimes it doesn't help some babies as well. But the good thing is that most babies will stop having colic by the time they're about 3 to 4 months old. It should stop. So sometimes just hanging there and it will stop. But the important thing is just to keep your baby comfortable. All right. I hope. Okay, yeah, I already suspected that when your baby is 1 month old, and I guess my guess is correct. So somebody is saying, Nikki is saying, how can I give spinach to my 8 month old baby? So spinach, there are many ways you can make it into a smoothie. You can cook it as a vegetable, and the most important thing is that it's salt is something the baby can take. So you can give your baby uh, like you can make a smoothie, the spinach with other fruits, with milk and all that, and then you can do it, or you can make it into like a normal, like if you're making porridge, you can cut it into small pieces and make it into it, and your baby can eat it as well. So there are many ways you can give your baby veggies and they can eat it. All right, so I guess that is what I have on Instagram for now. And then I'm going to go to Facebook, which really is where most of my questions come from. So if you're on Facebook, HCP moderators, help me to share the videos, help me to pin it because I can't do that right now. Okay, so Jennifer is asking, good evening, Dr. Gbemi. Is it good to use? It is good to see you again. Oh, yeah, thank you. Good to see you. All right. Is it necessary to take vaccine from those green uniform people that move around even after receiving all the vaccines in the hospital? Okay, thank you, Jennifer. This is a very important question. So I also tend to answer this question a lot. So when we talk about immunization, most of you take your baby for immunization in your either health center or the hospital, and we call them what we call routine immunization. So everybody know you give BCG at birth, you give Penta at 6 weeks, 10 weeks, 14 weeks, then you give measles at 9 months, yellow fever at 9 months, and meningitis A vaccine at 9 months. So those are routine immunization. You give them at those specific time. But sometimes we do what we also give what we call supplementary immunization. Supplementary immunizations are the vaccines that we give to children when there is an outbreak or we are trying to prevent an outbreak. So for example, if we think that we're in the measles season, we're going to have lots of cases of measles, then we will give the children an extra dose to booster their immune response. So they will go to the houses, or even though your children are taking measles before, we will give it again. Or like the common one which you are talking about is the polio one. So polio, because we're working so hard to eradicate polio, and I think we're making so much progress. But once in a while we get a report that maybe there's a child with polio, or a child who has tested for maybe for polio in the stool has been identified in a particular area, then we want to make sure that all the children in those areas are well protected. So we will give extra dose of the polio vaccines to all the children. So that is the one that people go from house to house to give. So we call them immunization days or supplementary immunization days, or that is what they have. So they are what you take on top. So because people tend to get confused, like, okay, I've already given this vaccine to my baby in the health center, so why do I need to take it again? You should still take it, because this is now like an extra precaution. We're trying to boost the immunity of all the children at once. So it is important that you don't refuse. You should take it. It's for the benefit of your children, and not just your own children, but all the children in that area. So sometimes when you give so many children the same vaccine at the same time, you increase what we call the herd immunity. That means that so many children are protected. And what that means, that the fact that you have so many children protected at the same time, they will even protect other children who have not even been immunized, who maybe come into that area. So at the end of the day, it protects the entire community. So that is what we call health immunity. So it is important that you take those vaccines. Just make sure that the people giving the vaccines, they are really professionals. You can ask them for their ID cards, or usually they wear their clothes showing that they're from the government and all that, so that they are just sure, So usually that's why they also go houses or go to the churches or schools. Most of them actually go to schools to give it to the children in school. But of course, we know that some children will not be in school, so that's why they also come to the house. So this happens all over the world, where we give extra vaccines. So there's nothing wrong for you to give them to your children. And there's nothing like you have taken too much of vaccine, because people ask that question as well. Like, oh, okay, my baby has taken extra dose. The vaccine does not harm your child. If you, let's say you're supposed to take 2 doses, you take 5 doses, it doesn't harm your child. It's just a waste of vaccine. So, but it's better to take a vaccine and maybe take extra than not to take at all, because the challenge is the child who did not take vaccine can have that disease that the vaccine is supposed to protect against. So there's nothing wrong with taking too much vaccine. And don't be worried that if you take extra, it doesn't cause you any harm. That's just a point. So I want to just reassure you. All right, I hope that's helpful. For those on Facebook, you need to, those if you are watching the group, you need to give Facebook permission to show your name. So if not, I won't see your name. But if you are happy with that, that's okay. Okay, so the next person wants to ask about Fontanelle. Is there anything wrong if the soft spot at the back of the baby's head is still soft at 5 months? Okay, thank you for that question. So we have 2 Fontanelles. Okay, well, let's just say we have 2. So we have got the anterior fontanelle and we have the posterior fontanelle. The fontanelles are just spaces. That's all they are. They are just spaces in the skull. And why do we have these spaces? Is because the brain is one organ that is not yet fully formed at birth. So because of that, the brain is still going to grow. So when your baby is born, it's only about 75% developed. So 95% of brain development occurs in the first 5 years of life. And that is why the head of the baby has to get bigger, because the brain has to grow. And that is why sometimes you see us pediatricians carrying our tape rule all over the place as if we want to sew clothes. We are not tailors or fashion designers, but we are measuring the brain of the baby, the head size, because that head size tells us that your baby's brain is growing. If it is not growing, it is a problem. So we always check to make sure that the baby's brain is growing. So that is why we have the fontanelles. So of course, after a while, they are going to close. Usually the posterior fontanelle usually close between 0 to 6 months. That's a very tiny one. It can even be closed from birth, but usually by 0 to 6 months, so it will close. And the front one closes around 18 months to 2 years. Now, there are conditions where the fontanelle may not close on time. There are conditions where they are too big. There are conditions that they may become swollen or they may become depressed. So the fontanelle itself is not a problem, because some people think when your baby has a fontanelle or you can feel the hole or it is breathing, or it is not breathing or whatever, that is a problem. No, those are just holes. The most important thing is that they give us information that if they are not closed at the right time, or if they are too big, or if they are too swollen, or if they are too depressed, they are giving us information about other things going on in the baby's body, and that is what we need to do. So for this person who is asking, at 5 months, I'm not worried about the fontanelle not being closed. Like I said, it closes between 0 to 6 months. So that is and it's the whole. It is not the soft. I because I really want to be sure. When you say the baby's head is soft, the back of the baby's head is soft. So I really want to be sure. The posterior fontanelle is a small hole at the back of the forehead, and it takes your maybe a tip of your fifth finger. So that is different from your, because baby's scalp or skull can be soft for different reasons. So you really need to be sure, because you say you're asking about fontanelle, but you're also talking about baby's head being soft. They are not the same thing. I know sometimes people, you are saying it the way you understand it, but it may mean different things if I'm looking at it the way you have said it. So the baby said being soft is not the same thing as the fontanelle being open. They are two separate things. So you really need to be sure what exactly you are really asking after. But because you say you want to ask about fontanelle, so I'm just trying to give you the information about fontanelle, which is the small hole at the back should close by 6 months, and the one in the front by 2 years. But if your baby said it's feeling soft for other reasons, please see a pediatrician so we know what is going on. Thank you. Next question is my 11-month-old baby doesn't allow me to clean up their mouth and teeth. Hope it won't cause mouth odor. Yes, this is a very popular question. Toddlers generally don't like you cleaning their teeth. So your baby is not different. Your baby is like any other baby, but you still have to do it. You have to do it as a mom because it's your responsibility. So there are tips to do it. Number one, the cleaning of the teeth is actually just for 2 minutes. You don't need to clean it for 1 hour or what. It's just 2 minutes, but morning and night. And usually you use a very small, soft brush, and then of course you use for this 11 months, so it's just a grain of rice toothpaste that they need, and they don't need to spit out the toothpaste or anything. They can swallow, it's fine. So you don't need to worry that, oh, but you shouldn't rinse it. Just leave it. Just brush, because there is, and usually at this age they don't have plenty teeth anyway, so you can easily do it, and try and make it interesting for children that are 11 months is still pretty young. Usually you should be able to do it. Make it interesting. Sometimes you can give them their home brush. Sometimes you can show them cartoons or people who are brushing their teeth. Sometimes you can, you do it together. You model it. You're also brushing your teeth, and your child tries. So the child does his own, you also now do it on top. So make it fun, make it interesting. So there are a lot of tips. Go to our website, we have lots of tips on how you can, our dentists have written about how you can help your toddlers brush their teeth, but you need to brush their teeth. And it's not just even about mouth odor, it's also about preventing what we call dental caries. So that is the teeth rotting. So sometimes you see children, their teeth are becoming brown, black, and the dentist have to take them out, which is not good enough. So so you should focus on that. So that's even more important. And I guess if you check our website, you'll see more tips, but I think I've summarized some of them already. Thank you. Someone is asking, my 7-month-old is yet to crawl. It was 10 kilos. Should I be worried? I won't be worried if it's 7 months old, it's not yet crawling. Babies crawl. So when it comes to developmental milestones, because people do ask me all these questions all the time, developmental milestones, we have what we call the average age where most babies will do things, but that is just the average. Some children will do it earlier, some children will do it later. And but for us as pediatricians, we look out for what we call the cutoff age. So the cutoff age is when pediatricians start to worry. And so usually the cutoff age is usually older than when you start. Number one, averagely, and then the first thing as parent you need to know is you should know what is normal. Because I have seen people ask me that their 4-month-old is not crawling, and I'm like, seriously? Why should a 4-month-old be crawling? Or the 3-month-old is not standing? So immediately people ask that question, you know that the first thing you need to do is to address the knowledge gap. So the first thing I always say, parent, before you start worrying, we are living in the age where nobody is permitted to be ignorant about these common things, because you have a smartphone, you have apps, Google is there. You can download all these things and you will know what is there. Or can go to our website as well. So you should know what is in normal milestones. When should a baby walk? When should baby crawl? What is the average? So that you will know that one first, then you know what to compare. So you don't put your baby under unnecessary pressure. That is number one. So even for this question now, an average baby crawls at 9 months. So it's still pretty early for you to worry that your 7-month-old is not crawling. And the reason why many parents worry is because you're comparing your baby to other babies. And like I said, it's an average. And I always tell parents when they ask me this question that I can't compare you. Also, everybody's a dad, but you're also not Dangote. So you don't also have the same money. So so if you are comparing your 7-month-old, then your baby should ask whether you should be, you should have so much money like other daddies do. So it is not nice to compare. The most important thing is that is there anything wrong? Is baby doing what should be done at the right time? So a 9-month-old should, that's a baby crawl averagely at 9 months. So some people will crawl at 7 months. Some people even walk at 7 months. But the average 50% of people will do it at 9 months. So that is number one. Number two, some babies never crawl. Some babies don't crawl. They do what we call bottom shuffling. So they just move with their bum, but they never crawl. So crawling is actually not a milestone to even worry about, because and it tends to run in families. So in some families, you will notice that your babies don't crawl. They just move with their bum. So it's not something to worry about. But if your baby is not crawling by 1 year and it's also not bum shuffling, then you can see a pediatrician. I will worry only at age of 1 year. So for those who will ask about walking, if your baby is not walking by 18 months, so we usually give a gap for those babies who are just, they are normal babies as well, but they are just going to do their own later. It's fine. But actually, we expect that even for those who are doing it later than normal, by 18 months, everybody should be working. And if they are not working at that time, then sometimes there's even still nothing wrong, but we just want to check that there's nothing wrong that we should be doing something about. So that's the most important thing. But the first thing first is, please know what your normal developmental milestones are. Neck control is at 3 months, sitting is at 6 months. Sitting with support. Sitting without support is at 8 months, crawling 9 months, walking 1 year. But remember, those are the average. Some babies will do it earlier, some people will do it later. But if by usually just had like about 6 months where your baby should be doing things. Or what I would say is that at the time you expect your baby to be doing something else, if your baby is not yet doing what should be before then that is when pediatricians worry. For example, if we expect your baby to be walking by 1 year, but even the crawling that is before walking, your baby is not yet doing it at 1 year, that is when I will worry. So I hope that's really helped. So for this person, there's no reason to worry. Your baby is a bit big, at weighing 10 kilos at 6 months. That is the weight of 1 year. So just also make sure that your baby is feeding properly, you're not giving too much food and all that. And you didn't tell me whether a baby was born too big at the beginning, so it's difficult to say. Yeah, but I'm not worried about the crawling. Maybe I'm more concerned about the weights rather. I hope that is helpful. Okay, I've answered this question. Next question: can a girl of 7 years has infection and discharge? I'm not sure why would you mean infection? I guess you meant infection, and you say discharge. So when people ask question, infection, discharge, you have not really communicated anything. Discharge from where? From the eyes, from the nose, from the mouth, from which part of the body? From the vagina, So you really need to be very specific. When you say infection where? In the blood, in the bone, on the skin, in the eyes, in the nose, in the mouth. So this question, as it is, I don't understand it at all. But a 7-year-old can have infection, a 7-year-old can have discharge, but you have not really asked which specific parts of the body it is. So don't just assume that we know which area you're referring to. We don't. You have to be very specific. So if you're still watching, you can repost your question. All right, so like Rita is asking, good evening, dear doctor. Thanks for all you do for us there. Thank you. My 8-month-old has this rash on the face for about 2 weeks now. What can I do to clear it off? Again, this is another question that assumes the pediatrician is omniscience or has superpowers. We don't. We're actually ordinary people. So for me to know what a rash is, I need to see the rash. So if I can't see the rash, how will I know what is cleared? So there are rashes that you don't need to do anything, you know. So maybe, for example, the child is having rashes as a result of a reaction to something. All you need to do is to stop the exposure. Some rashes are due to infection, some rashes are due to allergies, some rashes are due to skin disorders. So it is very difficult for any doctor to treat you without seeing you. It's really things like rashes. So and be wary, because I know a lot of Nigerians will do that a lot. We all have family groups, and we have healthcare professionals in our family, and you just tell them, this is what is wrong with my child, and you just tell you go and use this, which is what most mothers do as well. They also do it on ATP, and I'm always very happy to delete their comments and block them straight away, because it's a very dangerous thing to do. Even for us pediatricians, we don't do that. So you really need to have a proper consultation. You need to see a rash. There's no cream, there's no product that is a fix all. One of our dermatologists did a video recently about the danger of all these triple creams that people just use, and people just, oh, and I think I've written a memo as well about when people just, because people ask me questions like, oh, my baby has this rash and I've used this product and it has not gone. And they are like so surprised that why has it not gone? And I'm so amazed that how did you just expect it to go? Because number one, you've not told me what is the rash. You don't know what is causing the rash. You don't know what type of rash is, and then you just think because you have used this almighty product that people have advertised to you that it's a cure all, then it should go. I'm not going to mention any names on my program, but you all know what I'm talking about. It is not going to go. So rashes are, the first thing you want to know about rashes are what kind of a rash it is, what it is that is causing, then what is causing this rash, because that is actually the solution. Then we will know. And there's nothing like antibacterial, antifungal, steroid all together being used to treat. I mean, seriously, it doesn't work that way. So it's very unlikely for a child to have rashes due to three different things at the same time that requires all those three things. Those products, I really don't know why they are still in the market, to be honest. But you see that if you go to your doctors, they will really prescribe those products, because they will know, oh, it's a bacterial thing and we need an antibiotic. Oh, it's a fungal, we need an antifungal. Oh, it's an allergy. Can we know what is the child reacting to? Can we stop it? So those are the things we need to do. So I hope Rita, for Rita, what you can do is that you can post your question on our Facebook group. Now, for those of you who are going to post the question on the Facebook group with a picture, remember that it's also not enough to put a picture, because people just put a picture and they just ask me, what is the solution to this rash? And I'm like, I wish I have that superpower. I don't. You need to tell me what is the, you have to give me information about the rash itself for me to be able to answer it. For example, many mothers will post a picture. Let me use a typical one, and they'll say, oh, it is measles, it is measles. A drug can also cause that same rash that look like measles rash. Measles itself can cause it. There are other viruses that can also cause that same measles rash. So, and that is why I always tell mothers, when mothers tell me, oh, my baby has measles, I don't accept it, I don't believe it, because that is not how we make diagnosis. So the fact that it looks like the way measles rash look does not mean it is measles. So for example, a child who is going to have measles would have had fever, would have had cough, would have had catarrh, would have had red eyes for a few days before the child will now have the measles rash. And the measles rash starts from the forehead and goes down. So these are the things the doctors are looking for. So your baby doesn't have fever, your baby doesn't have catarrh, cough, and all that. Your baby just has a rash, and the rash is only maybe on the face, or maybe it's even start from the abdomen. It is not measles. It can never be measles. That is not how measles. So when we say you should give us information, those are the things we're looking out for. So, but if you tell me, oh, your baby has this rash, but you just use one particular drug or maybe a particular food your baby has not eaten before, and then I'm going to think, oh, maybe it's the allergy and all that. So, but if your child has fever, then I'm going to think, oh, maybe it's a viral infection. That is how doctors think. That is how we make diagnosis. We have to think of all the information we provide. So if you put a picture and you didn't tell me the age of the child, which is the number one thing people do,
They won't put the age of the child, that you won't even tell me whether your baby has fever or whether your baby, how long has the child been having the fever before the rashes. Is it itchy? Is it not itchy? I'm not going to know what is causing it. So that's why most of the time I'll just say you have to go see a doctor who will do all those questions and you will answer, and then we will all arrive at the conclusion. So it is very difficult for, and I take my time to explain it so that you understand that when you say rashes and we don't give you a solution immediately, it's because you have not provided those information that will help a doctor to take a decision. And any health professionals that just tell you to go and use something without doing what I just told you, we always do. Just know that you are dealing with fake people. And that's why some people say, oh, I've used this, or I've gone to this person, I've gone to that person. There's no solution. The question is, did they tell you what they are treating? Did they ask you? Did they go through those process? If not, there's really no point. So I hope that is helpful. So if you're going to post this question, you have to put a picture. You have to tell me the age. You have to tell me every other symptom. You have to tell me how long the rashes has been there. You have to tell me where you start from and where it is now. Is it the same way it has always been? Is it changing? So sometimes it's actually very difficult to do that on a Facebook group. It's best to do a consultation so that we can do the back and forth, and then we can arrive at the solution. I hope that's helpful. Okay. My time flies when I'm on this program. The next person is saying, my son will be 2 next month. Oh, now, this is another very common peeve of mine. When you say your son will be 2, to a pediatrician, that doesn't make any meaning. Is he 2-year-old, 2 weeks old, 2 months old, 2 day old? I have no clue. Let's just assume this baby is going to be 2 years old. But since childbirth, he has catarrh, which has never gone. Whenever he's sleeping, it sounds like he's snoring. It's but it's actually breathing. It sounds so loud. Yes, okay. I was given a pediatrician contact to book an appointment, but this consultation fee is quite huge. Oh my goodness, what can I do? Sorry. Okay, so your baby seems to me like a child who may have what we call adenoids, because the way you describe it, the snoring, the loud breathing, and all that, sound a child that may have adenoids. You have to see a pediatrician or an ENT doctor. You have to, you can see one in the private if you don't want to see, I mean, you can see one in the government hospital if you don't want to see private. I understand that private may be expensive, but you can see one in government hospital. Yeah, I know that some hospitals are on strike and all that, but that's Nigeria. So, but you just got your child need to be seen by either a pediatrician or ENT doctor, preferably. And if you can't afford a private, you have to see them in government. Okay, thank you. I know. Okay, you already told me is yes. Thank you so much for telling me that. Okay. The next question. Good evening, doctor. Please, I would like to know, what can a 3-year-old have typhoid fever? Yes, a 3-year-old can have typhoid fever, a 3-year-old can have malaria. But please, I'm very wary of all these hospitals that the only diagnosis they give you in Lagos, I think I'm always talking Lagos because I was in Lagos, is always malaria and typhoid. It is not true. Most of you that have typhoid, you're walking up and down and you're you're gisting with your friend, you don't have typhoid fever. So just all this one that you just go to the lab and they're always giving you, or you go to all these hospitals, the only diagnosis they always give is malaria and typhoid. Please stop going to such hospitals. And I'm saying that with all sense of responsibility. And please go to hospital where they examine your child and where they really look out for. If a child has infection, we look for where it is. And all this wider, it is not even, most of them don't even do it properly, and it's not a diagnosis of that. It is not what confirms typhoid fever, to be honest. But that is another discussion for another day. So please, if your child has fever, please go to a government hospital. If you are not sure where to go, if you are sure you have a good private where you have professionals, pediatricians, that's fine. Go to where they will examine your child properly, know where the infection is, and address it. Everything is not malaria and typhoid. Malaria and typhoid, no, it is not. That is one of the problem we have in Nigeria, but it is not supposed to be. All right. I think I should quickly go back to Instagram because Instagram people are going to be upset with me now. All right, I'll come back to Facebook. All right, so Instagram. Okay, I think Tony is still here. Yeah. Okay, sorry, I have to go back up and down. Yeah, okay. Yeah. So Shomi is saying, how do I know if I'm lactating well? Wow, this is it's a huge question, but I'll summarize. But the first thing you want to do is to go to our Facebook group or go to our uh Facebook or website. We have what we call the breastfeeding videos. The breastfeeding videos are quite good. I always recommend it. They're not made by us, they are made by Global Health Videos, but they are very, very practical and give you the information. So the way you know you're lactating, your breast will be full, your baby will be sucking every three. And when your baby suck, your baby will sleep for 3 hours or thereabouts. So you can even press it out to see whether your breast milk is coming out. So some of you, because the pressing is not as effective like the baby sucking it. So, but if your baby is sucking well, your baby is sleeping well, your baby is making poo or peeing, at least you are changing diaper like maybe 4 to 6 times a day, then most likely, and the most important of all is that your baby will gain weight. That's the most objective evidence of a baby getting enough breast milk and of you lactating well. Your baby is gaining weight. It is not, I notice I've not mentioned crying, and I've not mentioned baby wanting to suck all the time. Those are not ways you know you are lactating, because mothers get upset because their baby is crying, and I always tell them that's the only language baby speaks, and baby cry for everything, even when they are happy. So it is okay for baby to cry, and it is not, your baby like to suck. It's not because they're always hungry. Baby also suck for different reasons. Just for them to be with you and feel you, they will suck. So that's why they always want the breast in their mouth. So those are no ways to know whether you're lactating. In fact, you're lactating, your baby is eating well, sleeping, and gaining weight. Those are the objective evidence. And if you are not sure, you can also express your breast milk so you see how much you are actually making, and then you can see it for yourself. So I hope that's helpful. But if you want more information on that, please watch the breastfeeding videos. Tweety Liz is saying, is MMR vaccine compulsory for baby boys? MMR vaccine is for everybody, boys and girls. I don't know why you are worried about. MMR is measles, mumps, rubella. There's none of those things that has anything to do with girls. It's for everybody. In fact, the only vaccine that people would have worried about whether boys or girls is HPV. That is human papilloma virus vaccine. But even then, we give boys as well. So because that is actually what prevents HPV infection. HPV infection can lead to cervical cancer, which is a disease for women. But there are other things I can also call like warts, which can affect boys. So when it comes to immunization, we don't really have any immunization that is boys only. That's the honest truth. We have everything is for everybody. The only one that would even have differentiated would be HPV, but we give everybody as well HPV now. Tony is asking if I cannot find the BCG mark here on my 1 month old. I do not feel any boil. Okay, yeah. So you're asking about number one, it is too early to check for the BCG mark in your 1 month old. We normally check at 6 weeks. So if your BCG vaccine is given at birth, then the BCG mark check is at 6 weeks. And I know most of you don't even give it at birth. So they always tell you to come back, because the BCG vaccine is what we call a multi-dose vial vaccine, which means that once we open it, we must finish it. And one bottle is not for one person. So what people normally do is that we gather all the children together and give all of them the same day, so that once we open that vaccine, we can't keep it. It has to be given, and we must finish it. So because of that, many people don't even get BCG the day you give birth to your baby, which is ideally the day we should give it. So, and then, but usually we will check your BCG vaccine when you go, the BCG mark, when you go for your 6 weeks immunization. That is when they do check it. Now, the BCG scar is not always present in everybody for different reasons. So, but we need to know that your baby has a scar, because it's our way of checking that your baby actually produce a immune response to the BCG vaccine. So the BCG vaccine, by the way, is a vaccine that protects against tuberculosis, and which is endemic in Nigeria, in most parts of Africa. So when they give you the BCG, if there's no, number one, you need to know where to check. I hope you know you're checking on the left arm and checking upper. So you need to check that first. Now, if there's no mark, we will check another way. So what we normally do is to do what we call a Bantu test. We do a test to see whether your baby respond like a child who has had the BCG vaccine. So we will check. So if we check and your baby gave a response, so usually the Bantu test is another form of we will inject it into your baby's hand. And if a baby has gotten a immune response to BCG or exposure, there should be a kind of another swelling and all that. Usually it's checked after 72 hours. If the baby responded, whether there's a scar or not, then we don't need to worry. But if the baby does not respond, it is flat, then that means we are not sure your baby has put up immunity to BCG itself. Because BCG actually should be given under the skin. And some professionals are not very careful when they're giving it. So they give it into the muscle, and that means it's not going to work. So when they give you a BCG vaccine, you should see the vaccine come up like a bleb. You should see like like orange skin. You should see it there at that day, but of course it will disappear later. But if you don't see it that way, that means they're giving it too deep. It's an intradermal vaccine. It's just under the skin. It's not into the muscle like your Penta and the rest of them. So what we normally do is to check with the mantle test. So if the mantle test responded, there's a level of response we expect somebody who has been immunized with BCG, then that's fine. But if we don't get a response, then we will check that we does not have tuberculosis already ongoing. So we may need to do X-ray, or we'll just check. If we are sure the baby doesn't have tuberculosis, then we'll give the BCG vaccine again. And that's it. So I hope that's helpful. But you don't need to worry, because some people, if we check, they don't have a scar, but they responded well. There's no need to worry. Okay, I think final one from Okay, Shomi King, I've answered your question already, because you're asking, we don't know why baby is always sucking, blah, blah, blah. So I think I've preempted your question and I've answered it, because I know that that's the next thing you're going to ask. So I already answered that question very well. So I know. Okay, Udochi is asking, my baby of 1 year, 3 months isn't walking, she crawls, she holds things. Yeah. So if your baby is crawling, holding things, I'm not worried. If your baby is not walking by 18 months, then you can come and see us. It has nothing to do with calcium. It has nothing to do, I don't know where people get that from. Your baby walking or development has nothing to do with the calcium, has nothing to do with the bone. It has to do with the brain. All the development has to do with brain. So all this giving calcium, your baby is getting enough calcium from milk already. So there's no need for you to give any extra calcium. Your baby walking or not developing has nothing to do with bone or muscle or calcium. It has to do with the brain. And but for this your baby, I'm not even worried. Like I said, your baby is not working by 18 months, then that's when you should see a pediatrician. That's when we will worry. Okay. So I think we have answered all the Instagram questions. All right, let's go back to Facebook. And please, once it's 7, please don't drop question again, because our time is gone. Somebody's asking, what can I do for a 2-month-old baby with persistent cough that made him lose his voice? So a 2-month-old should not be coughing. A 2-month-old coughing to the point of losing his voice, I'm worried about that. So you really need to take this baby to see a pediatrician straight away. But the most important thing is to make sure the baby don't get exposed to people who are coughing. That's how the baby gets exposed. So make sure your baby is on exclusive breastfeeding. Make sure you keep them away from people who are coughing, sneezing. All these people visiting you for when you have a newborn baby, please don't let them be carrying babies. I know it's a cultural thing that everybody wants to carry baby, kids baby, but it's actually wrong, because they're all coming with their germs and putting it on the baby, and baby has little or no immunity to fight those infections. So keep your baby away from all those people. I always say babies, they come to greet you, not the baby. So you can go and greet them, but just the baby home inside is very important. And even the siblings, when they have cough catarrh, don't let them come near the baby, seriously. And make sure your baby is on exclusive breastfeeding. It's also protect the baby against respiratory infections. But you need to take the baby to see a pediatrician down. Sarah is saying, my 1.5-year-old always cry in school and develop temperature. What should I do? Why is baby crying in school? Though, really, to be honest, what is a 1-year-old doing at school? Or do you mean a crash? Because really, there's no a 18-month-old baby has no business at school. They have to play at home with you or with their sibling, or maybe unless you mean a crèche or play group, but they don't have any business being at a school. If you can clarify whether you actually meant a school or a crèche, because I'm taking your word the way you wrote it. And then sometimes they just don't like the place. Maybe they are not happy. And if your baby is developing temperature, then take baby to the hospital and maybe keep baby at home. So there's no reason why the baby should be having that. Another person saying, "Can I give my baby sleeping medicine?" Please, never. Don't give children. In fact, all children, don't give them any sleeping medicine. For what? Why? I mean, I don't understand. Some questions I worry about them, but please, I beg you, don't give any baby sleeping medicine. If your baby is not sleeping, see a pediatrician. Let's know why your baby is not sleeping. Don't give medicine for sleep. All those things don't. It can be dangerous. It is very not it can be, it is very dangerous. Another person saying, my baby didn't cry immediately at birth. His neck is strong now. And if I stand him on my lap, he will stand and play well. Okay, good. You've not asked any question. I guess you just want to provide me information. Um, Victoria is saying, my 3 month old suddenly stopped feeding with the feeding bottle, and my maternity leave is due. Please, how do I get him back on it? Okay, I actually like your baby because I actually don't like feeding bottle. We don't want your baby to be on feeding bottle to start with because it has its own wahala. So you can give your baby your breast milk with cup and spoon. That is it. You don't need to use the feeding bottle at all. So, and for your baby, another reason why we don't like feeding bottle is that at this stage you create what we call nipple confusion. So baby is sucking on the breast, is also sucking on the bottle, then you are confused. So sometimes that may explain what is going on with the baby. So I don't know what your plan is. So whether your baby is going to a crash, or your baby is going to go to a nanny, or your baby is going to be at home with somebody, you need to make a plan of how the baby will feed. You can, if your baby is going for a crash, for example, close to your place of work, you can go and breastfeed in between, when, every 3 hours or something. Or but baby can also be fed with a cup. Baby can be fed with cup and spoon, and not necessarily have to take a bottle. Because if you're also going to use bottle, then you really need to pay extra attention to the cleaning, to the sterilization, to the hygiene, so that baby doesn't end up having diarrhea and all those other issues that come with bottle feeding. Yeah. Okay. Now, how do I care for my baby's hair? Okay. How old is your baby? I have no clue. I don't know what you mean by care for your baby's hair. Wash your baby's hair with hair shampoo, put oil. That's all. I guess your baby is a girl. I don't know. You've not given me any information. And can I use hair supplement for babies? No. There's no supplement for anything. Just use your normal baby oil or whatever natural oil on the scalp of the baby. That's fine. You don't need to start putting babies through unnecessary pressure, hair supplement, blah blah blah. Just let them be, because baby will lose their hair as well. So some baby lose their hair and the hair will grow back again. So you don't need to start panicking over all those things as well. Yeah. Okay, Samuel is answering that your baby was big at birth. Okay, so your baby has already been big. So then that means the weight of 10 kilos we can understand, because your baby started very big. And I hope they've checked. Usually when babies are born big, we need to check them to make sure they don't have any health issues. So if that has been done, there's no reason to worry. Hamarachi is saying, is it okay to clean the tongue of a 3 month old baby? Yes, you can clean their tongue. Some of them have this breast milk coating on their tongue. So all you need to do is to put clean cloths in water and use it to clean their tongue. That's all. Please don't use glycerin. Don't use whatever tomato. Don't use all those things. Just use ordinary water and clean clothes. That's what the dentist recommend. And when your baby start bringing out teeth, then you start using the milk type of toothpaste for babies, and the baby toothbrush, very soft, gentle, clean. It's not raw. So those are the things you need to do. How that's helpful. Is crawling on the tummy at 8 months anything to worry about? No, I'm not worried about crawling. I think we've answered crawling. Crawling is from 8, 9 months anyway. Marie say, my 7 month old baby stool every 3 to 4 days. That's okay. It is not watery. Yes, it is not hard. It is, yeah, that is fine. So babies do not have to move their bowel every day. Everybody have their own what we call their own bowel movement pattern. So as long as the baby is not having constipation or diarrhea, we need to worry about it. Yeah, your baby should use family food at 7 months. That's fine. Yeah. Okay. Yeah, it's fine. Victoria, you can keep doing exclusive breastfeeding. I like to that you're exclusive breastfeeding. Just continue with that. Is it advisable to use both umbilical gel and methylated spirits? Okay, this is a very good question because I see mothers are missing it up, and I think my colleagues, the health professional, need to do more. We need to talk more about it because I've seen a mother who is using the gel every 4 hours or applying it 6 times a day, and I was going to faint. And you're not supposed to use the two together. So they are either or. It's either you are using the chlorhexidine gel for the cord care or you're using the methylated spirits. You don't use the two together. It's one. They are doing the same job. They are both anti, bacteria thing just to make sure that the cord does not develop infection. So if you are using the gel is meant to apply once a day. So usually when your baby is born, the nurses would have applied one. That is one for that day. That's all for that day. Then when you go home, the second day, when you finish giving your baby a bath in the morning, then you apply it, and that is all. In fact, that is actually why we created. That's why actually the gel was created. We want something that is easy for mothers to do, and it is just once a day, and that is the criteria. And use it for 7 days. Most of the time, the cord will drop within 7 days. Some their cord don't drop at 7 days. But the people that make the gel, they recommend it for only 7 days. So if your cord has not dropped by 7 days, you can switch to methylated spirits. Now, for methylated spirits, you have to use it several times during the day. In fact, what I normally recommend that each time you change the baby's diaper, you clean again with methylated spirits. So you use methylated spirits every 4 hours. So you in the morning you bath your baby, you clean with methylated spirit. Every 4 hours you clean with methylated spirits, and you clean well, not dab, which is what some people do. They don't clean. You have to clean properly, clearly the base of the cord. Don't be scared. It's a very tough tissue. It's not going to snap. So just clean it very well. It's really that base. All those yellow stuff should not be showing. You must clean it very well and clean thoroughly. And that is what you do. And keep it dry. You should always expose it to hair. Don't apply um don't cover it with bandage. Don't put um, um, bandage or anything on it. Just leave it open to hair. Don't even use the diaper to cover it. Just leave it exposed to hair. That's what you're supposed to do. But just stick to one. Don't do methylated spirit and gel, and no, it's not going to work. One is enough. All right. Can teething cause a 1 year 5 months old to drool saliva? Yeah, it is possible. That's one of the symptoms you can have in a child who is about to teeth. Which toothpaste can I use for my baby to stop his mouth odor? Number one, why is the baby having mouth odor? Mouth odor is not necessarily because of teeth. So you really need to see a doctor or a dentist because mouth odor can be from all the things within the mouth. Like if a baby has tonsillitis, for example, or a abscess, there are so many things that can happen in the head and neck that can cause mouth odor. So mouth odor is not always about hygiene. It's not about toothpaste. So no matter amount of toothpaste you use, if the baby is having tonsillitis that is causing mouth odor, if you don't treat tonsillitis, the mouth odor will not go. So you really need to make sure you see a doctor first. For your baby, you should use the normal baby toothpaste meant for children, for babies, and you use it, like I say, a grain of rice size. That's what you use, and you do that every day. Okay, Messi is saying my baby of 11 months always use the tip of his finger touch herbs, put in his mouth, everything. I'm not really sure I understand your question. I guess your baby is touching and touching things and putting it in his mouth. Um, my husband is so prone to avoid him putting things in his mouth, but he keeps doing it like he can touch my hair or eyes and just clicking in his tongue. Okay, yeah, this is something children do at that age. They touch everything because they are what we call in the oral stage of development. Oral stage of development, everything you give them goes into their mouth. That's the sense of That's the center of pleasure. So it's nothing wrong with that. But what you really need to do is to make sure that you're always washing the baby's hands, and you give baby something else, something like a teeter, something that they can, that is clean, that you can easily sterilize, so that they use that instead to put in their mouth rather than just pushing everything. You just have to make extra efforts, but usually after a while that stage will pass as well. But it's completely natural, normal development for babies to put things in their mouth at that age. But you just need to make sure you're washing their hands and giving them clean toys, sterilize their toys and stuff like that. um yes, I think you have answered the question. Yeah, okay. Yeah, okay. So, Rita, if you want to consult one of our doctors, you need to go on our Facebook group. I think we have our link for our WhatsApp, how to book a consultation. You can send a message to the WhatsApp number. Somebody is asking, my 9-month-old has a solitary swollen lymph node at the nape of his neck. It is not tender. I feel like it is attached to the underlying mucosa. He has rashes on his head at the same time. The lymph node was noticed. He was given antibiotics. He has completed it. The rashes resolved. The lymph node is still swollen. Is this something you should worry about? So, lymph nodes are normal structure in the body. Lymph nodes are normal in the body. They get bigger when there's infection or other condition. So as long as the underlying cause of the swollen lymph node has been treated, there's no need for you to worry. The lymph node itself will eventually goes down. We worry if it is getting bigger. I will worry more if it is getting bigger rather than it is still swollen. Obviously, the infection has just been treated, so give it some time, and you can also see your doctor for follow up. So I'm not worried about that. So uh okay, I guess somebody is just giving information. Uh, can your baby have ulcer? Ulcer of where? You have to be specific. Do you mean peptic ulcer disease? It's very unlikely in that age group, but in medicine we always say never. So, but don't make this diagnosis yourself. Please only see a professional. Only doctors, in fact, pediatrician should be making such kind of diagnosis in a 1-year-old, not you, not any other person else. Okay. I clean my 15-day baby in the evening after morning bath. And what's the appropriate time to start bathing them twice? Your baby don't need to be bathed twice. They are not going out. They are not dirty or anything. So there's no reason for your baby to be bathed twice. Once a day is enough for newborn babies. And even for infants, you don't need to bath them twice. Uh, you don't sit babies up. You put them on your shoulders because they cannot sit at that age. So you carry them up and put them on your shoulders and keep them vertical, but not sitting. They can't sit. They don't have the developmental capacity to do that yet. Um, okay, I think once your baby's cord has fallen off, if it is still has like a little wound there, you should keep cleaning with the methylated spray until it becomes like normal skin. That is all you need to do. If it is already like normal skin, you don't need to do anything else. You just bath your baby normally, clean your baby normally. There's nothing else to do. There's no special after the cord has dropped care. But if there's still like a little wound, like if the area is still a bit raw, then you clean it with spirit. Otherwise, there's nothing else to do. um I didn't give my baby rota 1 and rota 2. Your baby is 1 year. It is too late. If you didn't give rota at the latest you can give rota 1 is 15 weeks. The latest you can give rota 2 is 8 months. If your baby has not taken it at that age, there's really no point. And the reason you don't need to worry, because rota virus infection tends to affect baby between the age of 6 to 11 months. So your baby is going to have rota infection, your baby has already has it. So there's no need for immunization again. So there's no need to worry. Um, okay, we've answered the question about I just thought like a pimple on that arm. Yeah, the sky is like a pimples as well. It's not going to look like, when you say sky, it's not like, I don't know what you were thinking in your mind. But don't when you take your baby for your 6 week immunization, let the doctors and the nurses check for the scar. They know how to see it, because sometimes people are looking for something dramatic. No, sometimes it's just like a little dimple in that skin. There's no big scar, like it's not like when you have a wound or something like that. No, maybe that's what is scaring most of you. No, it is not. Okay, so HNM is your baby's 6 weeks immunization is after 4 days after. Yes, that is okay. There's no reason to worry. Charity is saying my baby 7 months, 2 to 3 times a day. I'm worried it's making him to lose weight. No, your baby passing stool 2 to 3 times a day does not mean baby to lose weight. As long as your baby is not passing watery stool, your baby is not losing weight. That is perfectly normal and it is not teething. You don't need to help him. Your baby can pass stools 2 to 3 times a day. That's fine. As long as it is not watery and as long as it is not hard, it is nothing to worry about. And your baby is not sick, baby is not having any issues. You don't need to help the baby. You don't need to do anything. All right. Faithfulness is saying, my baby is 2 months old on EBF. I do take pregnant care. Breastfeeding is he okay? It is perfectly okay. Okay, I think HNM is just buttressing our points about gel and methylated spirit. Some people, I think the problem is that the gel, I think we have some fake of those gels, to be honest. So, or maybe I don't know, I don't know really, but some people the gel seem not to work for them. So what we just do is to switch you over to methylated spirit, and that's fine. My baby of 1 year, 8 months, always touching his stomach. Well, there's nothing wrong with your baby touching his stomach. That is okay. I don't worry about that. And Nonna is saying, my baby of 7 months old has a lump in the breast. What should we do? When was the lump present? Was it present from the time baby was born? Because babies, when they are born, sometimes their breast is bigger than the it look as if they too are about to breastfeed, which is fine. It is just the effect of the mother's hormone on their own breast as well, and it will clear. And it's nothing to worry about. But please don't press it, don't massage it, because if you do, you are going to end up making it get infected, which is a problem. So Nana, because you've not given me that information, I'm not sure whether this is a new development or whether it's something that has been present from birth. If, for example, your baby has had that swelling in the breast right from the time baby was born, I'll just say leave it alone. But if your baby's breast has been normal before, and maybe now suddenly develop a lump, then we need to check to make sure there's no infection, abscess, or something. So you may want to see a pediatrician for that evaluation. Yeah, so this Facebook user who is worried about ulcer in a baby, please go and take your child to a pediatrician. Like I told you, it's very unlikely for a 1 year old baby to have any ulcer. So why will you even be thinking of ulcer if you don't have any symptoms? So why are you now thinking? So don't even think about ulcer. You don't need to know about symptoms of ulcer in a baby. If your baby, it's better to tell me what symptoms you saw in your baby and let me tell you what I think may be wrong, rather than for you to be walking backwards. So you are thinking your baby has ulcer, then you want to see whether, because if I tell you any little thing now, you are going to say, well, maybe that something that has nothing to do with your baby, you will think it is what is causing, or is your baby has ulcer. That is not how it works. It's better you tell us what is wrong with your baby. Don't always have your own diagnosis in your mind, or don't let people be telling you diagnosis by themselves. Please don't take diagnosis from fellow mothers, experienced mothers, and all that. It's wrong. Take your baby to the doctors. Let the doctors be the one to evaluate your baby and tell you what is wrong. So you don't get unnecessary panicky, anxious over nothing. So that's what I'm just going to advise. All right. Okay, Charity, is your baby, why is your baby too watery? So you need to check what food are you giving your baby. Make sure, like some of you, when you're giving your baby cereals, the cereal should be thick. It should be thick porridge. It shouldn't be watery. Your baby should not be able to take complementary feeding from bottles. You should not do bottle feeding as well. That's, those are the kind of thing that can cause diarrhea. The way you make the milk, is it the right quantity of milk, the right quantity of water? And we need to look at hygiene and all those things. So your baby is having watery stool, we need to find out first how to, though if it's 2 times a day, that's strictly not diarrhea. But if it's something your baby stool, it says sometimes it is watery, so it's better we check. A bit watery is different from it is watery. They are two different things. So you may want to post this question on our Facebook group so one of our moderators can ask you some questions and be sure what your baby really has so that we can help you. I hope that is helpful. Okay, yeah. So Nana saying that breast swelling is from birth. So like I suspected as much. So that is actually due to the effect of the mother's hormone just leave it alone. Don't do anything whatsoever to it. I hope that's helpful. Good. I really managed to answer all our questions today, and I just 5 minutes of it's 10 minutes after 7. All right, okay. I think I'm stopping now. So thank you so much. I'm just checking that I've not left Instagram people hanging. Yeah. Okay, I guess there's one more question on Instagram I've not answered. No, I've answered all. Okay, no, yeah. Somebody say my baby's pee is yellow and it smells so strong. Smell of what? What is the smell? That's more important to us. So I would just say you should be on exclusive breastfeeding. Your 4 months old should be on exclusive breastfeeding. Just breastfeed exclusively. That's all the baby needs to take. And Taiwo is asking about what food to give your baby at 10 months. At 10 months old, a 10-month-old can eat any food in your kitchen. It's just that you need to give it in the right texture. So usually the food at that age should be more of mashy, more of porridge. Please go to our Facebook group, go to our guide section and do the course on complementary feeding, because I worry about your apart from pap and cereal, because pap and cereal is not complementary feeding. It's a major challenge, because people always think when your baby starts to eat food, it's all pap and cereal. No, your baby can eat virtually everything else, and your baby should be eating everything, and your baby should be eating variety of food. And there's the yam, the rice, the semo, the amala, everything your baby can eat it, but you have to make it softer, porridge like, and all those kind of things for them. And by the time they are 1 year old, your baby can eat like anything from your kitchen. So Niona is asking, is agbo good for pregnant women? I'm sure you are in the wrong location, because we don't recommend ABA concussion at all. Whether pregnant women, whether children, no, no, no. Please don't give ABA concussion to pregnant women or to children, because it's not as if apps themselves are the issue, but the issue is what are the other things that are mixed, what are the things that are good, what are the things that are bad. So for example, if I give you paracetamol, I will tell you that this is the quantity you need to take, and I will tell you these are the side effects. And I know that if you take 10 tablets when I have you to take one tablet, I know that it can damage your liver. But people that gives you herbs don't tell you that. They don't purify it. So there are things that could be good in the herbs, and then there are other things that are dangerous to your kidneys in the herbs. So then you end up trying to cure headaches and end up with a renal failure. So please, we don't recommend herbs. So I know some of them are beginning to do modern way of, so that they know what exactly they are looking for in the herbs and all that. So you just have to be careful. And I would just speak for children generally. Please don't give them. I'm begging you, don't, because of those challenges and all that. Finally, Perfect Star is saying, I compare my baby block nose 3 weeks, try to take to the hospital, doctor prescribe everyday nasal drop. If they see having the block nose, then you take back to the pediatrician, take back to the same doctor. There's always room for, so doctors are not, we are not gods. So, and I've told you exactly that sometimes when you see a child, there are maybe 3 or 4 things that could cause something. And sometimes you may be able to confirm with a blood test or X-ray or whatever. Sometimes you're not able to confirm it, but you go for, okay, this is the most likely. But so if you start treating the most likely and the child is not getting better, then you start thinking of maybe it's not that, maybe it's something else, or maybe there's something else you should be doing that you're not doing. So that is why you should go back for follow-up. So the fact that you've gone to your doctor, things are not better, then you have to go back and let the doctor now review the child again and decide whether, oh, maybe that is something different that I should be thinking about. But if you don't go back, we will never know. So that is why if your child is not better with treatment, then you have to go back to the pediatrician for a follow-up. So that's what I'm going to recommend for Perfect Star. But I always want to sure, are you exclusively breastfeeding your baby? Because that is the best way to prevent respiratory infections. All right, I guess that is all on Instagram and on Facebook. Thank you so much, everybody, for joining me. So if you still have questions, I know because this is just going to be an hour program and I've already gone like 50 minutes extra and I'm going to close now. But if you still have questions, feel free to post your questions. If it's a question about children health issues, please post it on our Ask the Pediatrician Facebook group. You can't miss our Facebook group on Facebook. So you just look for Ask the Pediatricians. And if you ask a question about yourself, you can post it on ATP Family Facebook group. If you want emotional support for loss, miscarriage, or loss of children, you can join our ATP Still a Mom Facebook group. Unfortunately for Instagram people, we cannot do back and forth of question and answer on Instagram. So sorry about that. Because the structure of Instagram doesn't allow that, but we can do that on our Facebook group. So please, we appreciate if you join the Facebook group and post your questions there. And if you want to see any of our professionals, we also have what we call ATP clinics, where you can book appointments with any of our professionals. So thank you so much, everyone, for joining me. And I will see you again, God willing, or one of my colleagues will be here next week, Monday, where we'll do our 1 hour of ACP Live. Till I see you next week. Bye.